And welcome everyone. Thank you so much for joining this month's Fireside Chat. And so this Fireside Chat is in honor of National Minority Cancer Awareness Month. And so the Fireside Chats are brought to you by the Office of Community Outreach and Engagement at the Masonic Cancer Center at the University of Minnesota. The Office of Community Outreach and Engagement serves as a bridge between the Cancer Center and communities across the state of Minnesota. Our team's mission is to reduce the burden of cancer in Minnesota by engaging communities and providing them access to knowledge and information on the latest cancer research, cancer prevention, the importance of screening and early detection, treatment options, survivorship, as well as clinical research opportunities. My name is Amna Hussein. I am the Community Engagement Coordinator on our team, and I will be moderating today's panel discussion. On behalf of our entire team, thank you all so much for joining us today, and we hope that this conversation is impactful and powerful. So, racial disparities in cancer measures such as incidence or new cancer cases and outcomes have been well documented, with research showing that they are driven by a combination of structural, economic, and social environmental inequities that are rooted in racism and discrimination, as well as genetic and hereditary factors that may also be influenced by the environment. Despite significant advancements and improvements in cancer outcomes and treatment over time, disparities still persist. According to the American Cancer Society, African Americans have a higher cancer burden and face greater obstacles to cancer prevention, detection, treatment, and survival. Collectively, Black people have the highest death rate and shortest survival of any racial and ethnic group for most cancers in the United States. So today we are joined by an esteemed panel of local advocates working hard to improve cancer-related outcomes and eliminate cancer disparities in the Black community. It is now my pleasure to introduce to you all our featured panelists. So we'll start by Benita Robinson. Benita Robinson is a health program representative at the Minnesota Department of Health. Her duties include recruiting underserved populations to SAGE and SAGE Plus services, scheduling screening appointments, and effectively responding to all callers' inquiries and direct patient interaction to assess lifestyle intervention and risk reduction counseling, utilizing motivational interviewing techniques. In addition to leveraging relationships with the Minnesota Department of Health SAGE programs to implement cancer screening events in medically underserved communities, Benita Robinson works extensively with community-based organizations, including community health systems, faith-based organizations, community health workers, and local chronic disease programs to reduce cancer disparities among medically underserved populations. Benita is a member of the Minnesota Cancer Alliance, the Cancer Health Equity Network, and is a founding member and volunteer of Gilda's Club Twin Cities. Benita currently serves on the board of the Breast Cancer Education Association. She co-leads their outreach and inclusive committee, and also supports the breast cancer champions who support awareness and screening in their communities. Prior to coming to the Minnesota Department of Health, Benita was employed by the American Cancer Society for 5 years and was a volunteer with the agency for more than 15 years. In addition, Benita has an impressive career history working around cancer education, outreach, and support through positions with the University of Minnesota Medical Center, Southdale Cancer Center, the Minneapolis YWCA Women's Wellness Program, and the Women's Cancer Resource Center. So please all welcome Benita Robinson. Next, we have Reona Berry. Reona Berry is a founding member and president of the African American Breast Cancer Alliance, Inc., a nonprofit organization established in 1990. The mission of ABCA, the African American Breast Cancer Alliance, is to provide culturally specific information, networking, peer support, and hope in the struggle and survival of breast cancer and cancer in general. Reona is a survivor of breast cancer, first in 1990 with surgery. She had a lumpectomy, chemotherapy, and radiation. In 2019, she was diagnosed again, treated with therapy, a single mastectomy, and ongoing hormone therapy. Reona is committed to the mission of ABCA of being there to share, support, and strive and survive. She helps ABCA fulfill these goals by sharing information, creating cancer awareness materials, supporting survivors, bringing survivors and caregivers together to share their experiences, inspirations, and stories to help reduce the negative effects that breast cancer and cancer has on the African American and Black women, men, families, and communities. All right, and then next we have Shaunequa James. Shaunequa is a licensed social worker living and working in the Minneapolis area. She received her bachelor's in social work from St. Kate's University and a master of social work from the University of Minnesota. Shaunequa has a background in mental health, has worked as a mental health therapist in outpatient and inpatient settings. Shaunequa is currently serving as the program director for Gilda's Club Twin Cities in Minnetonka. She also serves on the board of medical practice and the Cancer Health Equity Network Planning Committee. Next, we have Dr. David Haynes. Dr. Haynes is an assistant professor with the Institute for Health Informatics at the University of Minnesota. He received his PhD from the University of Iowa in health geography. His current research focuses on how unequal access to care creates health and cancer inequities for minority populations. He does this by using computer mapping software to research how place affects health. His work uses spatial data to make cool maps that communicate this knowledge of health gaps to health researchers, practitioners, and broader communities. All right, last but not least, we have Kiara Ellis. Kiara Ellis is the Director of Community Outreach and Engagement at the Masonic Cancer Center at the University of Minnesota. She completed her bachelor's degree in Family Social Science and master's in social work with a focus on community practice at the University of Minnesota. She held previous positions coordinating grants at the University of Minnesota and health partners focus on creating support systems that lessen the burden of cancer and diabetes on diverse populations. Her passions lie in serving as a change agent for community and impacting systems change that will further cancer health equity in the state. All right, so that was a mouthful, but just to show you how esteemed our panel is today. So we will be recording today's session so that you can refer back to it, and it will be posted on our YouTube page. We will edit the recording before we post it to ensure your privacy. And before we get started, I think now, so make sure that you locate the mute and unmute buttons as well as the chat buttons. You can submit comments and questions in the chat box or send them directly to me during today's session. We will have time to take audience questions, but in a few moments. So please start gathering your questions, getting them ready and submitting them via the chat box. All right, so let's go ahead and get started. A big thank you to our panelists for joining us this evening. So first question, if you can all just briefly share with us why Disparities work, especially in the Black community, is so important to you. And I think I'll let Benita kick this one off.
Hi, thank you so much for having me on this evening. So cancer is very personal to me. I lost my mother when I was 20 and she was 46 years old. And the things that I know now that I didn't know then are very important. About the Gilda's Club and the Breast Cancer Education Association, the SAGE program, and all the programs that I'm connected with right now that I wasn't connected with before. I just want, people of color as a whole to know about all the resources and programs that are available to them so that they don't feel like they have to walk through the cancer battle alone.
Thank you. That's great. And just shows your passion to do the work that you do. I will go ahead and Kiara, why don't you take this away? So why is Disparities work so important to you?
I think working in Disparities is important because it doesn't necessarily have to be the case, right? I think we live in a state that's full of resources and education that people don't know about and don't have access to or don't understand how to navigate. And I think there's folks like us on this panel that are really invested in figuring out ways to improve access. That's not going to eliminate disparities, but for so long, communities of color and Black communities weren't allowed the privilege of knowledge, and being able to navigate things like the health system contribute to our overall health disparities that we see, especially in cancer. Finding cancer late, not going to screening, not paying attention to signs, and a host of other issues socially that, maybe bar us or make it more difficult to be a participant in healthcare. I think it's important, and I'm passionate about doing this work because we can make a dent in disparities with a lot of effort and pulling together the passion of a lot of the advocates here.
No, definitely. Dr. Haynes, tell us why disparities work is so important to you.
Yeah, I mean, I would agree a lot with what everyone's saying. I mean, I think the biggest thing for me is that we want to try and learn from the community and understand what they want to have happen so that we can kind of close those gaps. And I think that's what the work that I've been doing with some folks in the community is, trying to bridge those gaps and put programs in place that allow them to make the changes that they want to make, and make sure that that helps address the disparities.
Definitely, I think having community part of the conversation is so vital in, addressing and closing disparities and the gaps that we see. Reona?
Well, for me, it wasn't until I was diagnosed at age 38 that I learned how Black women did not know about breast cancer and the stigma behind it. And we've all heard those stories, probably when we were younger, that you don't talk about breast cancer or cancer. And one I remember hearing when I was in my 20s, it's like if a person went in for surgery regarding cancer, the doctor would open them up, see the cancer, and then close them up right away because the air would make it spread. So that kind of misinformation is one of the reasons why a lot of Black communities do not know about breast cancer or cancer and what they should do. And so they have a tendency to not seek treatment or diagnosis.
Thank you. And then Shaunequa.
I would echo what everyone else has already said. I think for me personally, I've seen the devil like up front and close, right? Like my mom and my grandmother both were diagnosed with breast cancer and both unfortunately passed from it. And for me, going through that journey with my mom so closely, it really made me realize like those disparities actually look like in real time. And so it's personal. And when I make something personal, I'm going to go after it with everything that I have until I can make some sort of dent in it. And like Kiara has already said, like it doesn't have to be this way. Like there are resources available, and it really is about like education, getting the word out there, educating like the professionals in the field, making a difference in that way. So I would say for me, it's just really personal.
And I'm sure for a lot of us, it is personal. And so we do the work that we do because of that and the changes that we want to see. So again, if you want to submit your questions, please feel free to do that in the chat box. We can take attendee questions. And so next, we tend to hear a lot that some of the root causes of cancer disparities are due to finances and social economic factors. However, beyond just finances and socioeconomic status, what else is contributing to cancer disparities in the Black community? What can cause cancer disparities by race and ethnicity? And, I'll open this to any of you to take the lead on.
I would say what I have noticed, and like, again, in my own personal journey with like dealing with family members, is like really the mistrust of like the medical community and like those working in the field of like oncology. Like that, I think sometimes we minimize how much that sort of affects disparities too, right? Like being able to trust the provider, trusting the system that you're getting your care from, especially with the history behind it. And so that, you know, in dealing with people of color, going through the cancer journey, going through these systems, that has been like one of the number one things. Is like, I'm not going to seek care because I don't trust them, whatever. Like, I'm not going to do that because I can't see myself working with this particular person. And then of course, like on top of that, like a lack of education, like Reona has already stated, but I think trust is like a major component to these disparities.
Mhm.
I would echo that as well. As if you don't trust the providers, the clinic that you go to, and I always believe too, if someone doesn't look like me or talk like me or even understand where I've come from, it's really hard for me to trust that they even have my best interest at heart. And again, 40 years ago when I went through this with my mother, but I've walked it through with other people, and not that much has changed, unfortunately. So the lack of trust of the healthcare system, like she's already said, and then just we're not always treated the same. You know, the same, a Black woman and another color could have the same diagnosis and get two different kinds of treatment. And we've seen that over and over again. And so that contributes to those barriers too, and those walls going up.
No, definitely. And someone just put in the comment that fear of losing a body part in hair is definitely another big factor for people not seeking care, right? You fear what you don't know. And so, you know, definitely body image has a lot to do with that. So thank you so much for putting that in the chat and sharing that. Does anyone else want to add anything to this question before we move on?
Well, yes, fear definitely plays a big role in the lack of service and treatment and detection, simply because we don't know, or we didn't know what would happen. In most cases, people's experience with cancer was the person died instantly within, you know, weeks or months, but that was due to a lot of times late diagnosis. Well, they didn't understand what late diagnosis meant. They didn't understand that if someone had the big C, meaning cancer, that it was treatable. But 50 to 100 years ago, people didn't understand what treatable meant. And it became, she died of consumption or some other disease, because they couldn't really label it where people understood it. So that continues to be a problem in all communities.
And I think I'd add, I think there is a piece around preventative care, not in all cultures, especially in our immigrant community, Black immigrant communities in Minnesota, is prevention a part of their healthcare journey. Like if they are not in pain or something is they feel bad, do they engage in the healthcare system, right? I think there's a lack of like understanding around the prevention aspect and how important that early detection really is to the outcome. I think especially even in Black communities, if your circumstances of your environment, your family life, your work prevent you from engaging in in your own healthcare or taking time to care for your health, then you really do lose out on that time. If screening happened early and cancer was caught early too.
Definitely. And I mean, going off of that, what do you think are the biggest barriers to supporting minorities?
So one of the problems that I think that's kind of from the healthcare system and from people in research spaces, we don't have enough, we're not really in other people's shoes. And what I mean by that is that we typically think if you have insurance, that means you use your insurance and you get your care and it's easy because you have a car to go get a screening appointment and all these things. And we're not enough in other people's shoes to understand the real support issues that you need to get all those things accomplished. And so I think that's one of the biggest things for my research, is trying to get in other people's shoes and understand all the issues that they have, because it's not as simple as I have insurance and I can access my care. It's way more complex than that. And so I think what we're trying to learn in these cases is get communities to explain, like, these are all the issues that we need you to address. in order for us to do this. And that just takes time, but the more community involvement, the better off we'll be.
Mhm.
Also, just because someone has insurance, that does not necessarily mean they know how to use the insurance or that they know what the insurance covers. Also, they have other, coexisting priorities. Just because you have insurance and you can have a medical home, are the appointments, when you can access them, can I take time off work to do that? Do I have childcare? Do I have transportation?
Mhm.
To address some of these issues? And then we also, as these big organizations, can't go in like we are the savior of the world and know how to fix everything. We actually need to hear the voices of the communities that we are trying to work with, and we need to actually partner with them, actually
Mhm.
walk alongside of them and work with them, and not just come in and try to take over like we know how to do everything. It doesn't work.
No, definitely. And I think really just addressing the root causes, right? And so addressing the social determinants of health and some of the things that you all have mentioned. And I see there's a comment. Yeah, so cancer care is extremely time consuming and there is still a stigma, of people losing employment. That is definitely for sure.
Mhm. From a social work perspective, right? Like I do assessments with people whenever I see someone, and I'm always assessing, well, like what are the barriers? What's preventing you from getting A, B, C, D, E, F, G done, right? And it really is like a Maslow's hierarchy of needs. Some people might have a diagnosis of a cancer, but like I don't even know where my next meal is coming from, right? So
Right.
like cancer is not my main focus, right? I'm not worried about this insurance. Like I have to focus on how am I going to feed my kids? How am I going to get to work? Where am I going to find a job? And that is a huge barrier that I think sometimes is overlooked in the medical system. And also, I think that our medical system is really reactive and not preventative, which is a huge issue, and which is why we need so much psychoeducation around like preventative care.
Mhm.
Well, I know in my cancer journey, I learned the word comorbidity. We found out that people have other health issues that probably sometimes takes priority, or the fact that they can't afford the medicine. They've even said, I can't afford to have cancer, because they've heard of the fact that cancer treatment is expensive. I mean, $1,200 a day for one drug. So they will forego treatment on cancer because they might have diabetes or heart issues. And those are pretty relatively easy for them to manage. But they also don't have that sense of morbidity, maybe in their heart problems or their diabetes problems. But cancer is the end all, the be all. So that's a big concern for a lot of people.
Very true, Reona. I remember at one point we received a bill. My mom was living with me at the time, and we received a bill from her clinic for $100,000. And we looked at each other and laughed because I'm like, this is ridiculous. Like, who's paying this? Like, why would you even send this to someone? Like, it got shredded, but it was like, why and like that's so overwhelming for people, right? Even for someone who like has insurance, just like the thought of how much these treatments cost. Like, why does that have to be a factor in determining whether or not I'm going to seek treatment for cancer? Like, it's absolutely ridiculous.
Especially if you have employer-sponsored health insurance, right? So like the risk of losing potentially your job and the stress that can add to how can I afford my medication if I'm no longer insured. And so go ahead, Reona, you went on unmuted.
Well, a new disparity that is affecting a lot of people is homelessness and housing. So if they have no housing or they have inadequate housing, how do they qualify to even get into a clinic?
Right.
It becomes a either or situation, and it's hard for people who are homeless to be seen if they don't feel they can even just walk into a clinic for an exam.
That's for sure. Does anyone have anything to add? Okay, I think we'll move to our next question. So we talked a little bit about just family history, and so why is understanding family history so important when it comes to understanding cancer risk? Are there any just tips that you can share on how to effectively talk about cancer with your family? I know that we talked about how it's taboo and to talk about cancer in Black families, but I think I'm gonna deflect this question to Shaunequa and Kiara to answer.
So I know for me, I was really young when my grandmother was diagnosed and then eventually passed from breast cancer. And so I had no idea what was happening. And it really wasn't until in my 20s when my mother was diagnosed that I kind of understood what was going on. And what was helpful for me, because I had 4 very small children. And like they were there during the journey where she's like losing her hair, grandma's sick, she can't get out of the bed. What was helpful for me was to like have that conversation, not hide it, right? Like make it sort of a normalcy, right? Because you're going to see your grandma in this state, right? Like these things are happening. We can't really avoid them. And like, there are books out there, right? Like there is education in ways that you can talk to specifically children about cancer and like what they'll see during that journey. But like kids are really smart too. So like it wasn't easy to try and hide it either. And then like, it's important for me because again, like I have a history there, right? Of breast cancer. I think the more that you're testing and the more that you know, the more that you can like effectively do preventative care, especially like if you do have daughters, like in my case with breast cancer. For me, it's all about them. Is like the reason like I want to know all these things, like I want to do all the things that I can to sort of help them prepare themselves, like if that were to be the case, whatever that may look like. So yeah, it's really important. It is a really tough subject to talk about, but again, like if they're seeing it in real time, I'm also sort of like, let's just talk about it kind of a person, is my personality. Like, let's just put it out there because we're all sort of saying it already.
And I think knowing and understanding your risk factors for disease is important broadly, right? Like there's certain risk factors for disease that we can control, behavioral things, but there's things that we cannot. And so understanding your family history, which is something that I think, especially in Black communities, we maybe not always talking about. Like cancer may be more obvious or out there for people to know that they passed from cancer or they had cancer or something like that. But a lot of things go under the radar, especially if we don't want to like make it a big deal or burden our family and maybe fighting a battle silently if you have small children and no other supports, that kind of thing. If you don't understand your risk, then you also don't know how to advocate for yourself for early screening. You know, if you're younger than the guidelines, but you have this family risk, you may qualify to be screened earlier or request it. There's things that you might be able to do, genetic testing that you might have access to because you know your family history. So being engaged in that process could help you in the future. My mother-in-law passed away from triple negative breast cancer, and my sister-in-law has been hyper aware of her health ever since. And they caught her cancer later in stage, and she felt like my mom was overworked. She just always put herself last. She felt a lump earlier on and ignored it until her son called it out. And that's when it's too late. And then her grandmother passed away from breast cancer and found out that an aunt on her dad's side, who she wasn't connected to, also had breast cancer. So there's power in having that information and knowing that you can do something about it too and use it for good.
That is for sure. Knowledge is definitely power. And I just want to kind of go off on something that you both touched on. So how do you advocate for yourself as a patient, especially, patient of color and navigating the health system?
I think one of the things that we hear in clinical settings often, and maybe just that this might be us from a professional side too, is that like the patient is the center of your care. And I don't always feel like that's true. And I think there's an intimidation factor that enters the room with a doctor that comes in. I think it's tough. It's really hard to advocate for yourself in a clinical setting where you feel like there's a power dynamic that you can't get over. But what you can do is ask a lot of questions. You can ask for other opinions. You can see a different provider. You can date your doctors, right? Like you can go and find out, you can see multiple people until you find a fit, especially in maybe your primary care before you're even at a cancer stage, which I still suggest you have more than one opinion about your care and treatment and exploring your options. But I think advocating for yourself is sometimes pushing back and having uncomfortable conversations, or bringing in a support person, because we all probably know somebody in our family or our circle who would have no problem speaking up for you too. So knowing like you can have somebody in the room, you can have somebody with a big voice that's going to say, no, we need to try this, or we need to figure out this, or explain this to me. You can ask for that additional support. You can also equip yourself before these appointments. You know, you can Google. Dr. Google is not something you should run with rampant. So that's, I'm saying a caveat with that. But you can look for talks on YouTube. You can look for materials from, Cancer Society, trusted sources, .govs, .orgs, University of Minnesota, Gilda's Club, folks that are represented here, to come in feeling empowered with information so that you can have a better experience in the clinic too.
I agree with all that. And like, there are resources like in our local community where you can sit down with someone to help, like, and they can help you go over what is it, what are the questions that you have? What do you want to say to your provider? Like here at Gilda's, we offer something called open options, where you can literally sit down with the staff and figure out what does your advocacy look like for you when you go into that treatment room. And I think it's really important that people understand that your doctors work for you. It's not the other way around, right? Like you are a part of that treatment team. You are the vital part of that treatment team. And so it's really important for your voice to be heard. And just like Kiara said, I tell people all the time, like finding the right oncologist is like finding the right car. You can test drive it. You do not have to buy that car same day. Like you can definitely go to someone else. You can even go to another state if you want to. And it's really all about like that rapport, that bedside manner. How are you being treated? Or do you feel like you're a part of that treatment team? Right. And like, I am one of those big voice people. Right. So you can always bring someone with you, which I always recommend too. So there's a lot of ways to advocate for yourself, but I think education is probably going to be the most effective way to advocate for yourself. It's just coming prepared for what are the questions that you have, right? What are the things that you already know that you want to know for your physicians? And like, of course, that power dynamic, but just knowing that you have that power, like you hold the ultimate power in those situations.
I love that. You have the power. I'm definitely taking that. So
I just want to add one thing too, that the oncologists are like your doctors, not the only clinical person that you interact with that can help you. Like those nurses usually are the gatekeeper and know more than the doctors about what's available in the hospital or in the clinic. So like, don't only rely on the doctor. A lot of the time it's the nurses, the front desk person, the care coordinator that's in the background, that's the person that refills your prescriptions, that know more things. So when you come in and they ask you that question, like, did you face any barriers to come here today? And you're like, I'm here. No, that question is really like, is there something else I can help you with? Like, can you afford to be here? Do you have transportation? Is there a problem getting your medication? Like there's other things that they're trying to ask you without asking you. So make sure you take advantage.
And honestly, like, don't be afraid to complain either. It's really not complaining. It's all about reform, right? Like if something's not right with one of these doctors, nurses, whomever, say that, write that angry letter, call the patient advocate, like do the things, right? Because they have to know in order to change these systems, because I'm sure you're not the first person to encounter that. And like I know that can be really intimidating, but like you have to call people out on the things in order for that to change. And that's just another layer of being able to advocate for yourself.
No, I know we all get the patient satisfaction pings. And so it doesn't take much to just complete those surveys and really be honest about your experience. Okay, so I'll move us kind of along here. So Dr. Haynes, I'll actually start with you on this one, but how can you kind of talk more about some of your research and some of the work that you're doing with the Breast Cancer Champions a project, but how is the community being engaged? Is the community being engaged to tackle disparities?
Yeah, so I work with Benita and a lot of other people, the Breast Cancer Champions Project, to help African American women and immigrant African women get access to screening care. And so Benita had been doing a lot of work, and Galen Richards a long time ago before I came on the scene, doing this sort of work, doing advocacy and community engagement and getting women access to this care. And my job kind of was to do a little bit of data analysis work and kind of provide a little bit of a structure around it. And so what we do together is we work with, I think it's Health Partners that provides the mobile mammography unit, and when we go out and we find those places. So one of the problems again with minorities and cancer is that it's hard for us to get access to that care. But there are ways for us to do that. And so right now there's a mobile mammography unit that we contact and we work with, and it shows up in your neighborhood. So that really reduces that barrier to care because it's there and it's there for a few hours, and the actual screening takes about 20 minutes. And so we work with community partners across Minneapolis and St. Paul to find those groups. And what we're really trying to do is find people in the community that have, tend to have some personal experience. Like, I lost someone from cancer. I'm really interested in this, and they want to be able to volunteer a little bit of time to do this. And what we really just try to do is help educate you about cancer, and yet put you in a position where you can use your network to find those people in your community that are not getting access to care. And I think that, again, this is a model that has been done in different places. And what we're trying to do is make it sustainable, make it something that's around. And, it's nice to have people like Benita who have good face recognition, that everyone knows who she is, and she's trusted in the community, and they feel like they can call her and ask her if there's any questions about that. And so what we're really just trying to do is, again, build those relationships with other folks in other communities to make sure that all the communities get access to the care, because it is difficult. But there are ways to break down these barriers, and this is just one particular option that we're choosing right now.
And we launched that project in the middle of the pandemic, and so we had to be really strategic and creative about learning how to use social media and other ways to reach women. And Part Nicollet, Health Partners Part Nicollet has that mobile mammography unit, and Galen and I and some others have been using and working with that for about 8 or 9 years now. And so it makes it convenient, as Dr. Haynes has said, because we can park that truck in your church background, yard, the shelter, women's shelter. We can park it in the park somewhere. And so women really do have access to screening. I work with the SAGE program, Minnesota Department of Health. So women who are uninsured or underinsured, SAGE is usually part of that partnership as well. And so we try to just make sure that not having insurance is a barrier to accessing care. The champions are there. Some of the champions are cancer survivors or caregivers or survivors. And so they're there to do education, to literally handhold. Some women really need a handhold just to get on that truck, just to fill out the form and get on the truck, and just know that someone has been through a cancer diagnosis and that they have survived, and that's very important. And so the Champion Project is alive and well, and we are working, and we are just going to continue this work until there's no work to do.
Mm-hmm, mm-hmm. You're all just involved in such incredible work, and the impact that you have is just amazing. And so thank you so much for all that you do. Reona, I know that you unmuted yourself, so go ahead.
Yeah, there's another part to that. Once a person is diagnosed, the other part is follow through and navigation. And when Benita and I worked at the Women's Cancer Resource Center, we were a patient navigation specialist for them, where we picked them up, took them to their clinic appointments, took them to their oncology treatment appointments, scheduled babysitting for them, everything that was keeping them from following through, we had to address the best we could. And in some cases, some of the women had no person, a family member to help them follow through with their clinic appointments. And we would sit there throughout their chemo treatments for 4, 5, 6 hours. Then we take them home. So that other part is very important, to be able to make sure that the woman gets all the treatment she needs and that she follows through, because there have been some women who would stop and say, I can't do this anymore. So we had to be the cheerleaders too, to be able to let them know that losing your hair or throwing up or getting these strange rashes were side effects, but they would go away because the goal is to live.
Mm-hmm.
And that's where we had to keep encouraging them. We're going to get through this. You will get through this. And be able to know that we advocate for them to help them empower themselves to advocate for themselves too.
So beautifully said. Thank you so much, Reona. Does anyone have anything to add before we move on?
I just want to add, like, Reona, I love what you just said. And I think, you know, the part about, like, I think that's why I love the Champions program too, right? Because like they have someone that they can connect with and that understands the journey that they're going through, someone that understands, like, and I think that's a missing component for minorities too, because it's like, it feels like a really lonely journey.
Mm-hmm.
And just knowing that there's someone who looks like you, who has gone through this or who has had a family member go through this is a really connected way of getting through it. So Reona, I just love what you said, just so eloquent. I love it.
Yes, and definitely, I mean, that's why talking about it is so important, right? And so if you're not talking about it, then you don't really know what's going on and you think that you're dealing with it alone. So Dr. Haynes, I have a question for you actually. Can you speak a little bit about the rates or the incidence of cancer in people of color, different racial and ethnic groups? Have they increased? Where are the trends?
So, you know, it depends on the types of cancer, but, you know, breast, lung, colorectal, we tend to be the highest for mortality specifically, and sometimes kind of a little bit lower on like being detected for incidents, but we tend to die at the highest rates for all of those. And I think that that's really due to these fear factors that we know that are kind of into our culture, where we know our people are scared because of different reasons to get screened. And I don't think that's should be underplayed, because it's a very real thing that when you think about going to do this, that people are very cautious and not wanting to do it. Like, I'd rather just not know. But what we've seen in general is that there are more of us that are getting screened now, but we're getting screened late, which means the cancer is more aggressive. It's harder to treat, and we tend to die because we don't have access to the support. And so what I think is really important to think about is that, you know, through the Champions program, we've connected with more community organizations that are doing this work. And sometimes, you know, I think lots of different community organizations do lots of different things, and it's hard because we're like all fragmented, like trying to help. And what I think has been nice is that this is allowing, like, conversations like this allow us to find where we have synergies and where we can work together and make a bigger impact in our community. So I think that, you know, there is light at the end of the tunnel. It's trying to figure out how we can all kind of collectively work together in certain spaces, because I can only do so much, but maybe you can pick up the next spot, and then someone else picks up the next spot there. And, you know, that helps us all kind of get to the goal that we want. So that's kind of where I think we're looking at for cancer rates.
Okay. So Benita and Reona, this question is for you. Can you share any successful stories around early screening efforts that you've been involved in that have targeted Black communities. So share any of those successful stories.
Well, I already mentioned the Champion Project, but I can just throw out some numbers here. So again, we said that we had launched the Champions Project during the pandemic. And so we trained over 14 champions. We've reached over 2,000 women. We've had about 448 women referred for screening, 228 screened. We built relationships with clinics, faith-based communities, community centers, and just co-partnered with people throughout the community to reduce this unequal burden of cancer. And so that part, those partnerships of relationships, Galen always says, don't work in silos, we need to work together. You have strength, we have strength. And if we put all that together, we can really help address these cancer burdens in our community. And so that's the Champion Project. It's moving, and we're just gonna keep it going.
No, those are phenomenal numbers. Reona, do you have anything to share?
Well, we don't do the statistical part of it. We don't have numbers. We just connect with people. How they find us, and we're finding the internet is a great source of connection for us, but we're at the point on the continuum of breast cancer and cancer that we're the support part. We're the education and support. As far as detection, we participate in community detection programs, with SAGE and such. But it's when a woman has been diagnosed and treated, that's when she also needs us or needs a group. And the fact that they kind of go hand in hand, because a lot of women had said, if I hadn't found out about ABCA, I wouldn't have known about SAGE or the American Cancer Society. So there we work together and create a network, because that's how the Sisters in Harmony program started, to create the network where from point A, B, C, and D, the whole continuum of where a woman needs to have assistance to be able to get through this. She is able to at least know that she won't be dropped. She won't be left hanging. We're available. And all the resources that are out there, people just don't know about. And that's why community-wise, we do have to network together and to make sure the woman does not fall through those gaps, because that's what's been happening. People just fall through gaps because they don't know where to go, who to ask. And that shouldn't happen. It really shouldn't happen.
Okay, and looks like we have one question asking about, are there any resources for Black men? So health-focused resources. Are any of you aware of any?
I don't know any, oh, sorry, go ahead, Reona.
No, you go ahead.
I don't know.
Assad.
I don't know any resources that are like specific to Black men, but I can tell you, like at Gilda's, we run programming that's specific to Black people, right? So like a support group that's specific to Black people, and it can be men or women. And we also run a men specific support group. So like those could be different resources.
Yeah, and for us, as far as breast cancer is concerned, it doesn't matter. If a man's willing to come to the group and talk, that's fine, But it is kind of hard for a man to discuss breast cancer if he's been diagnosed and treated with maybe a lot of women, and until he's comfortable, but we're open.
And then Dr. Haynes, I saw that you unmuted for a second.
I was just going to say that colorectal cancer has been like the newer one that we've been focusing on for men. And there are some Black researchers. Charles Rogers used to be at the University of Minnesota, and now he's in Utah. He's been doing a lot of work with Black men and colorectal cancer. So there are, there are a few researchers of color also doing these things, but there are people that are doing that. So sometimes it's about trying to find the community and the researchers so they can work together to kind of work in that space.
So I see that, can't believe the hour just like ran by here. But okay, I think one more question, a takeaway for the audience, and I'll have each of you kind of just briefly answer this question. But what role can individuals play in helping to reduce cancer disparities in the Black community? So I will let Kiara, you can start with this one.
I think I'm I didn't know I was gonna go first.
We can come back, it's okay.
I think one thing to do is to just always kind of lead with empathy, right? Like, I think there's lived experiences that people have that are very real, especially, and I almost want to just say from a research standpoint, because of who I represent in the Masonic Cancer Center, there are historical traumas that have happened, times where people were mistreated in a medical setting, were surprised by what a treatment or a screening was and talked badly about it. And now the person who heard those messages is fearful of taking a next step. We hear messages from our elders who we usually respect and trust and lean into for advice that causes fear. So I think as a community member or a provider or a public health professional, really lean into understanding someone's personal experience in care, in cancer, because those things ultimately could determine their behavior and the way that they show up.
Perfect. Benita, what are, just a final takeaway for the audience, what a role that an individual can play in helping to reduce cancer disparities in the Black community?
Well, they can make sure that they educate themselves, and that when they educate themselves, that they share what they know with someone else. And we can make sure that we continue these collaborations that we have started and that they grow, and that we, as has already been said about the empathy, and sometimes you have to do a little self-disclosure even to share your story with someone else, and that might give them the empowerment to actually make the move and take the test or do the screening or do the follow-up appointment or participate in a clinical trial or something like that. You give them that power and that encouragement, and that they know someone's going to walk alongside them.
All right, Shaunequa.
I would say always lean in with a lens of like equity, right? So like if you're a healthcare professional, what are those policies? What are you seeing in your organization? And again, call those out. And a really practical way that you can advocate for Black people in the cancer space is like plugging your legislators. We always need money, right? Like we always need programming and funding. And I know my legislators are sick of me. Like it's okay to write a letter though. It's okay to call them and like advocate for certain things that the Black
people.
Yeah, absolutely. Like again, they work for you. Just remembering that.
Love that. Thank you. Dr. Haynes.
I think one thing that I would be helpful, so we run into a lot of these systemic issues, and I think one thing that would be great is to see is having more people of color in the healthcare industry moving up the ladder to kind of help address these issues. There has been some reports that kind of said that we've kind of peaked in terms of percentage of minorities in healthcare settings. We're like going down in percentage. So like if you thought we had a lot before, it's going down now. And so, we need to have more people in this space, and that helps with a lot of these issues where someone, again, they've had some family experience and they're going to have more empathy for you because, you look like someone they know, and they're not, they're going to take that time. So, I mean, I know that's a long goal, but I think having a few more of us in this space will be very helpful for all of us going down the line.
Definitely. And then last but not least, Reona.
Well, I think also encouraging people to take action, because yes, you can be diagnosed, but the brick doesn't stop there. I mean, you have to keep walking through this path to see the doctors, make decisions, get information, taking action, because a lot of times people tend to let fear stop them. And fear can kill people, obviously, but we also need to be able to feel that we deserve to be healthy. We deserve to be able to get the right treatments, the right doctors, to be able to say that I'm worth having a healthy life and living. And sometimes people of color have a problem with that. And it's hard. It's hard.
That was just the perfect way to end this. Thank you so much. Just all of you, Dr. Haynes, Kiara, Shaunequa, Benita, and Reona, thank you for the time and just your engagement. And the discussion today was just so impactful. And for me, I think so inspirational. And just, I hope all of you kind of feel the same way. So you will receive an email shortly after today's session with a quick survey. So we would really appreciate if you could just take a few minutes to provide us your thoughts and your feedback about today's session, because it will help us improve future fireside chats. And then after completing the survey, you can enter to win a swag bag filled with Masonic Cancer Center goodies. And then, as promised, I'm going to just quickly launch the poll again, just for anyone who did not get their attendance marked. So I'll just launch this quickly. So if you didn't complete the first poll, go ahead and just do this one quickly. And then if you are dialing in, make sure to direct message me your full name and email address. And so the Amazon e-gift cards will be emailed out probably early next week to everyone who attended. And then please make sure to follow the Masonic Cancer Center on all our social media platforms so that you can stay up to date on our future announcements, as well as events from the Office of Community Outreach and Engagement. Well, thank you everyone so much for joining us today. I can't believe we're already out of time. And honestly, I feel like I could talk to these five for even longer. So thank you all so much for joining us and just for taking the time to be here today. So,
Thank you for having us.
yeah, thank you, Benita.
Yes, thank you.
Thank you so much.
Thank you. Yes.
Bye, everyone.
Bye-bye.
Here.